Medical cannabis dispensary owners say the state's program isn't growing due to a lack of access. Right now, state lawmakers are considering a bill that would improve access to medical marijuana here in Texas.
Some doctors say the THC in cannabis can help treat several health issues, including epilepsy, Parkinson's disease, and multiple sclerosis. Here's KVUE's Darenisha Heron. She spoke with a mother about how the proposed changes could help her child and possibly thousands of other patients in Texas.
10-year-old Jacob Ortiz's health hasn't always been an upward climb.
His epilepsy was sporadic. It was unpredictable. He has what's considered complex partial seizures.
His mom, Kaylee Cook, says in 2020, doctors prescribed her son medical cannabis through the Texas Compassionate Use Program because his epileptic drug was no longer working.
I'm not sure if I really remember it because it's been like a really long time since I've had one.
We're almost 4.5 years seizure free now because of starting the medical cannabis.
Senate Bill 1505, filed by State Senator Charles Perry, aims to expand access to the T-Cup program in many ways, including changing how it's measured to allow access to other forms of the medication.
So instead of only selling edibles like these gummies, the changes would allow them to provide things like inhalers, patches, or capsules.
This is really important for patients with episodic conditions where they feel something coming on immediately and want immediate relief.
So much simpler for somebody who's approaching their teen years, right, and doesn't necessarily want to bring a tincture along.
The bill would also allow licensed dispensaries to operate satellite storage facilities to make it easier for patients to access prescriptions. The CEO of Texas Original, Nico Richardson, says currently they have to store the medication at one facility and use drivers to drop it off across Texas.
It's very costly, and it can lead to some pretty extensive wait times for patients to get their medicine. So this should make medicine both cheaper and more accessible to patients across the state.
Lastly, the bill calls for adding 6 more licensed dispensaries in Texas. Right now, there are only 3.
Hopefully it reaches somebody who might be questioning what the options are.
And that was KVUE's Darenisha Heron reporting. Lawmakers heard testimony on Monday, and so far, no action has been taken.
Meanwhile, the state Senate's been considering a bill that would ban the sale of all consumable hemp products containing THC. Senate Bill 3 would also make it illegal to market or sell those consumable hemp products to minors. Lieutenant Governor Dan Patrick and other lawmakers say retailers across the state have exploited the law passed back in 2019 to legalize hemp with up to 0.3% THC. Right now, SB 3 is still in committee and has yet to advance to the full Senate.